So, Dr. Seth, as I was flying to Tampa, I was actually looking back on my phone, on my text messages, and it was actually a year ago that we met. And we'll probably talk a little bit more about that, but I just want to say it's absolutely been an honor of mine to see you in this journey and to transition from being a hospitalist to now a very successful concierge doctor. So it's been an honor to be part of this process with you. But, you know, I was curious, and I think I'd love the opportunity to really get to know you a little bit more, kind of what started this process, who you are. I really want to go way back to why did you become a doctor? What led to this moment right now?
I think why I became a doctor, there's a lot of things that go on to that when you choose to apply to medical school, as you can imagine. Mm-hmm. I had always thought about doing medicine. I was never really focused on medicine. I think I had a lot of different desires at the time. After I graduated with my degree, I ended up going into finance and worked for a bank in my hometown.
Canada, right?
Yeah, in Winnipeg, Canada. Yeah, and I worked there, and I worked in a small town, and I noticed, that it was, I was selling financial products, loans, mortgages, etc. And my mother had done that, and we had family members who were in the banking industry, and I could see myself in a path down the road, and it just felt like I wasn't doing the service that I was hoping to do, that I always planned to when I was a kid. I was hoping to make an impact. And so making an impact, selling loans, mortgages, it wasn't working out. And so one day my
impact as much as you were hoping.
That's right. And the other thing is my now wife I was dating her. She was in nursing. And she would tell me some amazing stories like, oh, we did this, we took care of this patient, we saved this person's life. And I'm just like, well, I sold a package of loans for a car. Now, that was a very big deal for that person, but I was hoping for more in my life at that time. Mm-hmm. So one day I just applied to school, applied to medical school. I randomly did my MCAT and ipso facto, here we are.
Did you apply to school in Canada?
I did not.
Okay.
I was already older, and for me to go back, redo some grades, get a higher MCAT score. My point in life was that I was at that age where I had to go now. So, so that's what we did.
Gotcha. And I think it's really worthy to mention that you and I both attended the same medical school.
That's right.
A few years apart, but talk to me about your experience going to an offshore medical school.
Yeah. So I went to Ross University. It's a international Caribbean school. I think when I was in undergrad in Canada, I think the places that I'd done science and learning, they were not very positive on the experience of the Caribbean school. When I went there, I met 1,000 Canadians and 2,000 Americans. There's so many students here. And I realized that there was groups of people who went out to that school. There was very hardworking people who just didn't have the opportunities to get into the medical schools because it was so competitive. And then the opposite end was people who were not serious. And those people didn't end up getting past the school.
Was there a fear going to an offshore medical school? I don't hear it as much now, but the thought that you weren't good enough.
Yeah.
That you obviously did not do well in school.
Yeah.
You didn't do well on the MCAT.
Yeah.
And you were just sent off to this Caribbean medical school to have fun.
That is what drove me to this day. And I think you and I share a lot of that, is that there's that insecurity that, for 4 years we felt we weren't good enough. I tell you, when I would go on the awards, there was nobody who was working harder than I was. I was studying harder, longer hours. Meanwhile, half the other guys were not. But it was that insecurity in me
Right.
that was developed.
And I always say that insecurity, I think, is what has made certainly me, and I know you, an outstanding physician. That I don't think those individuals who didn't experience what we experience, I don't think they will know. I do feel that it made me a better doctor at the end of the day.
Yeah.
But I can't help but think that there's always a little bit of that insecurity that I have to almost prove myself in a way.
But that's okay.
Yeah.
Because that's why you've gotten to where you are, and that's why I've gotten to where I am.
Right.
You know, I've had the opportunity of working with guys who've gone to Ivy Leagues and you know, the Harvards, the Stanfords of the world, and you know, they're human beings.
Right.
You know, they all pass the board exams that we have to. They all see the patients. The real question is, do they make that connection?
Right.
Right? Do they make that impact on the patient? And I think that's where you and I differ from a lot of people, because I think we worry about every little level.
Yeah.
You know, we worry about is not only are we making the impact in our lives, but into the patient's lives.
Right. How old were you when you started school?
I think I was 25.
Okay.
Yeah.
Okay. You know, I grew up in a small town, and I knew from a very young age that I wanted to do something that could get me out of that small town. I am so grateful for growing up north central Nebraska, small ranching community. My parents were truck drivers, were not college educated. And I saw how hard my parents worked and had nothing to show for it at the end of the day. And I felt in some aspect I was a little bit better than this small town that I grew up in. You know, I wore the Wranglers, the boots, and I just felt a longing for something better. And I was very sick as a child. I was diagnosed with this rare GI issue, esophageal issue. That's actually an esophageal dysmotility disorder, and I was in the hospital for about 3 years of my life.
Oh, wow.
And I recognized in those moments of being so sick that I woke up one day and I said, I think I want to be a doctor. You know, that one sentinel event that really defines our futures, right? And so that was really the sentinel event for me, was being so sick as a child and also wanting something better than what I was born into. So I went to a small undergrad college in Nebraska called Hastings College, and had 3 best friends. We were all bio majors. We were all going to take the MCAT together, which we did. And they all ended up going to the University of Nebraska Medical Center. And I was the one that unfortunately did not get accepted.
To University of Nebraska.
Yeah. And it was very challenging because here we were 3 best friends, and everybody else went on. And of course I didn't. And it was also at a time, and I'm going to get very personal with you here. It was also at a time that I was hiding something for so long, and just that fear of that people finding out, and you know, who knows? But I'm gay, and I decided at that moment that I was so tired of lying to myself and others that I just needed to come out of the closet. So, you know, it was a rough transition for me, but I'm so grateful because, you know, I got to meet so many outstanding people. And again, you know, I always felt that I had to prove myself because of the insecurity that I felt. And again, not getting into UNMC was just another fuel to the fire that I wasn't good enough.
Right.
But I ended up, that's for another topic, but ended up going to Ross and had a great experience there, and of course residency. But what was some of the hardest things about going to medical school for you?
I think, you know, reflecting, I think medical school was not as tough, not the schooling wise, like the experience, because prior to that, just like you went through your own difficulties, and by no means it was similar, but we all have, I think, I swear to God, I think the early 20s
Hmm.
are like very challenging for a young man's life.
Yeah.
And I remember I think I remember I had applied to like a dental university at that time. I was just looking for something to do. I applied to dental school. I got through the process and I didn't get in. And that really upset me. And I didn't get, and that wasn't in my plan. And so for like a year and a half, I like lived, in an apartment, I moved out from my home. I was like trying to figure out who I was in the world. And I think the biggest thing for me was I realized, I know this sounds really silly, but I realized I wasn't the gifted guy I thought I was.
Hmm.
How everybody thinks like, oh, I'm pretty smart. Well, you get a real shock to your system when you're like, you're like everybody else.
Yeah.
You just have to try much harder.
Yeah.
And so when I went to medical school, I came in with that chip in my shoulder, which was, I'm not talented. I'm not God-given gifted. I have to work harder than everybody else to get to where and that is what pushed me through. So, for example, like, in Ross, they had these, the teachers' assistants, the TAs. The first like week, I remember saying like, I gotta be that guy. Like, I knew that if I wasn't there, I didn't mean enough.
Mm-hmm.
And you had to have good grades. You had
Sure.
to be in the top, I think it's like 5% of the class. I did everything I could to get there. And I remember the first exam, I did okay. And I was like, I'm not going to get there. And it was just a constant drive.
Yeah.
And part of that was the insecurity. Part of that was also looking back and saying, you're not gifted. You have to work now 3 times harder.
Yeah.
You see this one guy,
I get it.
you have to do even more. And so I thought medical school for me throughout that process was always like a ravenous like animal.
Mm-hmm.
And I was always constantly working harder and harder.
Mm-hmm.
When I went to clinicals, I benefited when I was in New York. When we did rotations in New York.
All of them in New York?
No, I did most of mine at the Cleveland Clinic in Weston, Florida.
Yeah.
And that's where I fell in love with internal medicine.
Mm-hmm.
But I also realized like I was too aggressive of a medical student.
Mm-hmm.
And I was like studying too hard, not necessarily studying too hard, but I was just being too aggressive. Yeah. And that's where like that balance of medical school and like being a gunner versus not being a gunner is that you have to find that balance. And
sure.
That to this day is something I struggle with.
No. I think for me, obviously coming out of the closet, going to medical school, Caribbean medical school, so the insecurity with that, and I think the push to try and prove myself that I was good enough and fight those demons in my brain. Coming out to my parents, again, small town Nebraska, very conservative, love them to death, but my dad said, I'd rather have a dead son than a gay son. How could you do this to us? No one is ever going to go to a gay doctor. How dare you do this to us? And that
was your father saying that?
Yeah. And of course you're in medical school and working hard, failing classes, the demands, and it was a mind game for me for the longest time thinking, is this real? Why am I going to put in the effort to try and make it if I can even make it at all? And then once I do make it, is anybody even going to come to me, right? And so the fear of being judged and going through that was a challenge, and something inside me kind of lit that said, I'm going to do this. I have to do this. And, at the end of the day, I hope people judge me being a excellent doctor that thinks a little bit outside the box, that is going to work very hard to provide the best medicine I can for patients. Again, being sick, having that doctor and that medical team respond to me, growing up in a small town that I think gave me a lot of those skills and those humble beginnings that I think were all conditioning me to where I am today. So,
was there anything that helped you get through that time?
I think it was a lot of probably some soul searching. I think definitely my faith probably got me through. I was in a long-term relationship that I also think was probably good in some aspects, probably bad in some aspects. Without him in my life, I probably wouldn't be here where I am today either. I don't talk to him to this day, but I think it was still part of that journey that got me to where I am today, which I'm very grateful for. So yeah.
You know what got me through mine? Grey's Anatomy. I'm not kidding.
Are we on season 40 now?
This is season 2. Yeah, no, this is. So when I applied, season 1 and 2 had come out.
Yeah.
And right before my interview, I don't know what I was doing, but I watched them all in a weekend or something. And I was like, it's just such a stupid show. But I mean, sorry, but like, some people like that show. But after the first few seasons, it got a little silly. But there was a scene in that. There's a scene in the show, and one of the characters says he was talking about how he struggled in medical school, and he struggled with being with all these gifted students, and that's the thing about medical school. That's actually the thing that shocked me the most is I'm reading the same book you are. Mm-hmm. How are you absorbing it better? Like, I just didn't understand. Mm-hmm. There was one guy, he used to study, I swear to God, like 5 minutes, and he would kill me in the exams. Yeah. And so I knew that I had to beat him, and the only way I had to beat him is if I studied harder. Mm-hmm. And in that movie, he says, what I lacked in natural ability, I made up for in effort. And I took that statement and put it at the bottom of my email because, Gmail was just out at that time. Of course. And I was like, that was going to be what I lived and died by. And I put the fake doctor and I put it like as a saying by this so famous doctor. And then somebody like a couple of years later is like, did you just quote Grey's Anatomy in your Gmail account? I was like, it's time for me to delete that.
Hopefully you didn't learn some of what they were doing on Grey's Anatomy, but no, it's a great show. Great show. Why did you go into internal medicine?
So I had thought that I wanted to do a thoracic surgery. Every medical student who says that's like, I'm going to do the biggest, most complex, most difficult, most painful. It seems like that's the way to go. Mm-hmm. I did my first rotation was in OB at the University of Miami, and I actually really loved it. We worked in Little Haiti, and there was a OB clinic there that they took care of the local community for basically nobody spoke English. It was a Haitian population. Now they speak French, Patois, and Creole of some sort. But I knew from my just a little bit of French that I could understand a little bit. So I got some relationships with the patients, and I started to make a connection with them. And the doctor who trained us, he really let us very hands-on, very involved in the care. It was really great. So I really fell in love with OB, and I was like, I think this is going to be my main thing. And I wanted to do gyn-onc and stuff like that. And I had gone down this pathway of figuring it out. And then but the only thing I didn't like, it wasn't cerebral. It wasn't
challenging.
It was challenging, but you didn't think medicine all the time. You didn't think about blood pressure. You didn't think about you did, of course, in pregnant patients, but it wasn't the whole body. It was very focused on that one area. Mm-hmm. And then, I did a peds rotation. Peds was amazing too. But it wasn't until internal medicine when I started to do rounds, and I like to talk, and you get this opportunity to talk, and you get to talk it out about patients ad nauseum, and you get to study like crazy, and I was already a pretty avid student, and I really enjoyed it, and honestly it was the nerdiest of all things, and I was like, this is for me.
This is for you.
Yeah, and so there was that, and then the first time I was on the wards, I was in the ICU, and swine flu had just come out, and we had a couple patients in the ICU with H1N1, and it was a really exciting time, and I really thought this was for me. I had thought, eventually that I would do, either intensive care or cardiology, something really in depth, and I would go and do that. And that's kind of how I ended up going that direction.
Gotcha. Where did you do residency?
I did, at the University of North Dakota.
Okay. 3 years, right? 3-year residency.
It's a 3-year internal medicine residency. Yep.
Okay.
And then I worked there. I still work there, and I'm part of the University of North Dakota faculty. And
Awesome.
Yeah.
I do want to talk about that here in a second.
yeah,
So,
where did you do your residency at?
yeah, I initially had applied for 12 programs. I was really interested in internal medicine. I thought I was always interested in forming relationships with patients, and I felt that was an area of medicine that I could really, really do well in. And I love pediatrics. And so I couldn't decide if I wanted to be just a straight internist or a pediatrician. So there's actually a few programs in the United States that offer a combined med-peds residency. So I had applied to the program in actually here in Tampa, Nebraska, Maine, and a few other programs. And actually Tampa was my top choice, and I did not match there, but I matched at Maine Medical Center in Portland.
Where in Tampa? Do you remember which program?
The University of South Florida.
Okay.
Yeah, they have a at least they did at the time, a med-peds program. But thankfully, looking back, I did a 4-year med-peds residency at Maine Medical Center in Portland, Maine. Had a great experience. There was 3, counting me, in my class, and had a great experience. Very academically based program. Learned a lot about clinical medicine. Did not learn anything about real medicine, which has also fueled the fire for me to really try and maybe teach the next generation.
Now, when you say real medicine, what do you mean by that?
I think I think what we do every day.
Mm-hmm.
I was not prepared, especially coming out of residency, to balance insurances and what the insurance companies have done to set us up for failure in a way. And I don't want to just blame the insurance companies, but just the system itself has made it very difficult to be a doctor, which I don't think at least my residency program didn't really train me for that. They certainly didn't train me for what I do now as a private practice owner. But it taught me the clinical skills that I needed to be an outstanding physician. I met my husband while I was in residency, and decided after 4 years, we ended up moving to Las Vegas, and we've been there since 2013.
So when you guys were doing residency, you said clinically it was fantastic. So if you were to go back to the department head and say, I have some suggestions about your program.
Mm-hmm.
This is what I'd like for you to add. This is what I'd like for you to subtract.
Yeah.
What would you recommend?
I think, and this, I'll just talk for my program, but I think it would apply to maybe all graduate medical programs. I wish they did a better job of training doctors how to be entrepreneurs or to think like private practitioners.
It's a great point, because whenever you talk to them about that, I shouldn't say them, educators in the schools, they'll always say, after you graduate,
you'll learn it.
You'll learn it, or do your MBA.
I got an MBA.
Yeah.
It didn't teach me anything. It has just been trial and error, as you probably know. But I would tell them that they need to focus a little bit more about empowering the next generation of physicians to think like entrepreneurs. I feel like there's just this unwritten rule or law that says you're going to graduate medical school, you're going to go to residency, and then you're going to get gobbled up by a corporation, and you're going to work for them tirelessly for so many years and do their bidding and follow the administration's guidelines to see 40 to 50 people a day. Bill as much as you can, focus on volume and not so much quality.
Right.
So I really wish that graduate medical education programs would talk about empowering physicians to think like business owners, private practitioners, because I do feel, this is me saying it, I think medicine is better in the private sector.
Oh, yeah.
So,
You know what's interesting is you think about why. I mean, there's so many people that talk about the state of affairs of why we are where we're in healthcare. I think graduate medical education has a big role to play in this, and not as a negative part, but I think you have a very good point. Think about it this way, and I think about it the way when I was coming out of medical school, I had a debt of around $390,000,
mm-hmm.
right? And I have a child. I have a wife who's working. So we have and then I'm going into my first job.
Mm-hmm.
I'm already a resident. I'm making a very small salary, which is not paying me enough to even pay the interest on my loans.
Mm-hmm.
So every day we're going into the negative, right?
Mm-hmm.
And, you know, my wife says, so where are we going to live next year? And I said, we're going to live in the same apartment. And that's what we're going to do. And we're going to handle and we're going to, you know, keep our costs down, etc. The only thing I was thinking was, how do I pay my debt down? And if you take it from an entrepreneurial standpoint, you'd say, well, you can't do that.
Right.
You have to invest in your entrepreneurial job position, right?
Right.
You have to have investment. You're going to have to more lending.
Right.
Thinking about adding hundreds and hundreds of thousands of dollars on top of your already hundreds of thousands of dollars on loans is impossible.
Right.
So then, like everybody does, you sign a contract with an employer. That employer gives you a great job, gives you a great salary, gives you a lifestyle, and you go, I can do this. It's only until years into it, you're like, oh, maybe there's more to this.
Right. I think there's a lot more to this. And, you know, looking at the debt that we accrued throughout our training, and yes, for the most part, salaries for physicians are great. We work our asses off. And I think in some cases, maybe in the primary care world, we deserve a little bit more
100%
for the work that we do. But for the amount of loans that we have working in a traditional primary care office, I say this, I don't think I'd be able to ever pay off my loans. I think I'd live in the red for
100%,
forever.
100%.
I think being a business owner and seeing the advantages of that and reaping the rewards. Granted, it is hard. Yes, it takes on its whole other separate set of demons, but the rewards financially are much better. And I wish graduate medical education programs would talk a little bit more about that.
Yeah, I agree, and I think graduate medical education programs are trying to add in, but if you look at the details of their education, a lot of it is for coding to the hospital or the system, right? They're not teaching you about prior authorizations and stuff, and that as much as you don't want to deal with it, that's a reality.
It is,
right?
Yeah.
Like if I wouldn't want to deal with some of the pathology I have had to deal with.
Right.
The reality is that's the goal. That's the game I've chosen. So I have to deal with it. I have to learn about it.
Yeah.
Just because I don't want to doesn't mean I should.
Right.
Therefore, same thing with insurance. There should be a program to teach us about that.
Right.
Now, insurance companies, they change the ball game every day. That is one of the things but that's also what you need to learn.
Right. Why hospitalist medicine? And what does it mean to be a hospitalist?
So a hospitalist is a general physician who takes care of patients on the medical floors. They can range from mildly ill to critically ill.
And you started this right after residency.
Right after residency, 2014. So I started there. I have always felt fairly confident with my skill, but when you leave residency and you don't have somebody helping you, I was a little worried about the first time I went out, and so I was always like, I'll work in the same program that I was taught, and if I ever need some help, I can talk to my old attending.
Sure.
And we joked around that our hospital program, it has PGY 4 and 5, just with a better salary. PGY 4 and 5 is, a postgraduate
Yeah.
year, and internal medicine is only supposed to have 3 years, and then the fourth and the fifth year, well, they're imaginary because every day I was talking to my colleagues saying, "Hey, would you do
What do I
this?
do
Would you
here?"
do this?"
Yeah.
There's a great example of a patient. A patient came in with kidney failure. I sat and struggled with this patient, trying to understand. I was ordering tests and I was like trying to figure this out. And then I reached out to one of my colleagues and he looks at the renal panel. He goes, "Oh, did you look at the protein albumin ratio?" And I'm like, "No." And it's not like that's like something that was like very visibly obvious to me. I'd only seen it. And so he's like, "Well, look at this and look at that. And looks like multiple myeloma." It didn't look like that on the CBC. Anyways, long story short, he was right. Now, I will never forget that. So.
Yeah. Was there anything that happened in your career as a hospitalist that made you transition or want to think about other opportunities, not just concierge medicine, but was there anything that made you think about other or better options out there?
So a caveat is, I think the group that I worked with in the hospitalist department is fantastic. Like it's that was probably the hardest decision I've ever had to make because it's such a great job as a hospitalist. You get to see sick patients, take care of them, help them, treat them.
What is a daily... I'll go back to your other question. Sorry to interrupt you, but what does it look like to be a hospitalist? What does your daily routine look like?
So like it's a 7-day job, and if you want to, you can work a little bit more. So it's 7 days in a row. So you start on like a Monday, for example, and you get a list of patients. That list of patients, we were maxed at a certain number.
How many?
We were maxed at 16, but as they call it, a soft cap. Like sometimes it was busier and you'd have like a 17 or an 18, but it's very, very rarely.
Majority 16 patients on your census.
Majority of the times
throughout those 7.
Around 16, yeah. Sometimes it was less too, but 16. Okay. You could confidently come to work and say, "Where's my 16?" If you had less,
great.
Bonus. If you had more, dang.
Okay.
Now, every one of those patients are super complex, right? Because that's a tertiary center. Patients are being flown in from different facilities. So they are not here for like, simple pneumonias most of the time. That simple pneumonia is being managed in the rural hospital in the middle of, Minnesota. So
these are complex cases.
And so, you have to do your due diligence. You have to read through the chart. You have to understand what everybody was talking about. Some of those patients have been there for 3 days, 10 days, 30 days, and you got to go through all that stuff. Yeah. So Mondays, busy, read through everything, go through the labs, understand what's going on, understand the plan. And so just that understanding and reading takes a while. And then you go round on the patients, you see them in the hospital, you create a relationship. And that relationship is a shortened relationship. I am coming in on day potentially 20 of a patient's hospitalization, and I might say, I disagree with some of this stuff. And now this patient who's been sitting there for 20 days has this physician who comes in and says, "Well, I may change it, or, let's continue with the same process." And that patient, he or she may have had a very good experience, or they may be fed up and frustrated that nobody's talking.
Yeah.
Right. And so now I'd be sitting there. I had a rule. One of my like old attendings always told me in every hospital room, sit down. I know that sounds like a simple thing to do, but he always said that if you stand and do a visit in the hospital, every patient will feel like you're leaving the room, even if you're in there for an hour. He's like, but if you sit in the room and you're in there for 5 minutes, they'll think you're in there for an hour.
Forever, yeah.
So I'd always sit. I always brought in that wheelie chair, and I always sat, and I just hung out. And part of it was just tell me a little bit more. And then, you'd hear, some of the frustrations that patients have being in the hospital just in general, or some of the very, very positivities, like we've had a great experience, etc. And so that's part of the day to day. And then, at the end of the day, you come back the next day and you do the same thing over.
So you're rounding obviously looking at the charts, rounding on the patients, putting in orders, speaking to nurses, speaking to specialists, rounding with medical students, residents, talking to families, triaging. Was there a push to see more patients, do more that you felt was maybe unnecessary, or is there anything in that role that you did not like?
I think
most doctors would say, this is great. You work 7 days and see patients for what it is and be done.
Now, anybody who knows me knows that that wasn't an issue with me. And that is only because, I was always that driven dude. So I was always like, I can do more. I can do more. Our hospital did a really great job of like making sure to keep balance. Their a big focus was burnout, and that's a fantastic thing. That's also a very differing experience in some places in the country.
Yeah.
We had friends who were colleagues in other hospitals, and they were purchased by private equity, and they would be like, I came in, the list was 40 or 35. How am I supposed to see these patients? Meanwhile, our hospital had a very, very strict limit about, amount of patients you had, amount of shifts you could do in a row, to focus, make sure.
Would there be another hospitalist that would come in with you, or was it just you?
It was just me.
For this particular medical service?
Oh, yeah, for my service, but I think we have like 30 services.
Okay.
Right. So it's a big system, big hospital system.
You're employed by the hospital or by a hospitalist group?
Where the hospitalist group is part of the hospital, and so we're employed by the hospital.
Got it.
Yeah.
Okay.
So whenever recommendations from administration came, it came from the higher ups. We had a really great leadership board that like made sure things were taken care of, but you toed the line of the corporation, and you made sure that like, and when I say toed the line, it's like, they're not never have we ever been told to do a wrong thing, never. But they want to make sure services is their experience is good, and so
What made you want to go from primarily being in a hospital setting to an outpatient setting?
So I still work in the inpatient setting a little bit. It's something that keeps my
skills.
Skills very sharp, and it makes me still be very cognitively savvy about critical illness and stuff.
Sure.
I was part of the ethics committee in my hospital for 12 years, and there were so many cases of patients who would come to the hospital and say, they would be hospitalized for extended amount of time, and nobody had a goals of care discussion with them, or nobody had conversations about like, this condition you have is terminal. And if they did, they've been told it was terminal by like 15 people, but they had seen 15 doctors or 15 providers at that time, and they just stopped listening. Yeah. And there was so many times where I was like, and they'd say, can you be my doctor in the primary? And I'm like, no, I can't. I'm an inpatient doctor, and I knew the reason why they wanted it was they have a connection.
They saw something different in you.
Right. Or that they could just relate to me.
Yeah.
And one day Neer and I were talking, and we were just saying, maybe there's just more for us to give. Maybe we can, create a process where we can have a smaller group of patients that we do our darndest, our best, and make sure that we may not be able to change the world, because, when you come out of residency, you really want to change the world. You want to do something great, big for the system. What you realize is the system is giant.
Yeah.
You got to work on doing your best for that group.
Yeah.
And so that's what we want to do.
Got it. So tell me, what are you currently doing now?
So currently, my wife and I have opened up a concierge medical practice. We're located in Tampa, Florida. It's called Seth Premier Medical. And our focus is to have concierge medicine for our patients.
Mm-hmm.
So what that means is inherently we provide almost a luxury service at an affordable cost, and we make sure that we are their quarterback with medical decisions, that we're their quarterback when it comes to healthcare and their decisions of healthcare. And also we help them figure out and navigate the healthcare industry, including their insurance. So if they have issues with insurance, I've worked with insurance companies through my other roles in the hospitals. I know how to talk to insurance companies. I know what things may or may not work. And I feel that it is my responsibility to be a part of that with my patient.
Do you think all these years as a hospitalist has prepared you for this role? I know we're going to get into another episode of talking about concierge medicine and what that means, but do you feel prepared to be in this role?
I think hospitalist medicine helped me a little bit. I was also a physician advisor for utilization management for my hospital, and I was also I'm still the physician advisor for the enterprise for coding and for the hospital. So I understood like the levels of nuances with insurance. I still don't know ins and outs of it. And again, they change the goalpost every day.
Yeah.
So
no one does.
Yeah. But I can tell you that I can call bullshit when I see it. And if I see something that the patients are like not benefiting from, I'm like, forget that. I'm going after them.
Yeah.
And when I mean going after them, I'm calling them. I'm talking to the medical director on call. I want to know why you denied this.
Yeah.
I want to hear the reason why.
Yeah.
This one time, and I used to, I would have these conversations with multiple medical directors. And what you realize is, I would say they're not bad people. They have a construct they're working in between. And if you give them more information, they'll be, oh, I didn't know that. Okay, all right, turn it over. I've met some rude ones, and I made some complaints about it, and those complaints were fixed, and we still got it through. But at the end of the day, what have my patients been able to do through that process, right? Like,
right.
What would Jim, who's 82 years old, whose medication got denied, or his hospitalization got denied, how is he supposed to talk to the medical director for X healthcare system?
Well, they don't, and they get lost in the system, and that leads to a lack of care, a lack of therapies in a lot of cases, and who knows what happens to that patient in the end, which is very sad. It's interesting. Out of residency, I took a much different career path than you. Obviously, as an internist, spent a lot of time on the wards, and really did not feel a calling to be a hospitalist. I worked in Las Vegas at a traditional medical practice, outpatient primary care office. And and this is where I go back to what I said before, I don't think I was even really prepared for real life medicine. Granted, residency's hard, you're seeing a lot of patients, but the demands outside of clinical medicine, what I saw and witnessed fresh out of residency, it was staggering. So imagine seeing not 16 patients, but 40 to 50 patients in one single afternoon, and also trying to navigate medications that weren't approved, trying to get prior authorizations for imaging, trying to manage patients that were upset for waiting for 2 hours to see you, and trying to keep up with notes and the demands of documentation, and doing that every day. So I would work 5 days a week and spend my weekends documenting. So the burnout factor for me was extremely high. And I thought, man, is this how real medicine is supposed to be? And I thought, gosh, I'm not a quitter. I went to an offshore school, insecure about that. I'm going to prove everybody wrong, have the echoes of my, my situation behind me. But I said, what, I'm not going to quit. I'm going to keep doing this. And it got to a point 2 years into this that I said, I've got to walk away.
Right.
And I ended up leaving clinical medicine for a little bit to pursue an MBA. And the one thing that taught me was it taught me to do a little bit of business research and to give me some wings to be an entrepreneur. And I learned about concierge medicine, or this idea of concierge medicine. And I took it and I ran with it. And it just so happened after I graduated, I had an opportunity to work for Lifetime Fitness, which is a national fitness chain, and was recruited to be their medical director at the Green Valley location in Henderson, Nevada. And it was almost this dream come true job. I could form relationships with patients. I could be a doctor that focused more on preventative strategies and preventative medicine, incorporate a nutritionist input with a personal trainer, and we would build personal plans for patients to really get them outcomes. Right. So amazing job, yeah. Right? And then as most entrepreneurs, I think, would say that after a while you get the itch and you realize that I'm making all this money for a corporation. Why can't I do this on my own? And so it just took a little bit of faith and some loans from mom and dad to help me make the jump. So in 2017, we opened the doors to Parker Medical, which is a concierge practice in Las Vegas. And we've been doing that ever since that time.
It's amazing. So you guys have been open for 8 years now?
Correct. Yeah. We opened our doors in February of 2017.
Amazing.
Yeah. We had one patient that started. When I left Lifetime, I could not obviously recruit any patients that had signed up. Obviously, some of them found me, but it really was, it was hard the first few years, but patients, for the time that I was in Las Vegas, you do build a reputation, you build a name, and people will find you. And I think at the end of the day, I have done no advertising. I have just made a point to, in every interaction, to be the best doctor that I can be. And like you said it, patients really just are looking for an advocate to help them fight and navigate through this system that is becoming so difficult, yep. Not only for doctors, but also for patients. So it's been a dream job.
So I think about one of the things you mentioned about patient advocacy, after we decided to kind of move to Tampa and transition our careers, when we were building our practice and the idea of the practice, we were kind of thinking of what we're going to be. We knew what we wanted to provide to patients, mm-hmm. but we knew that, the execution was very difficult. Mm-hmm. And what services would you provide to your patients? Why would they choose me versus go to somewhere else? That I found very, very difficult. And
do you know the answer to that?
No, I still don't, because I think every day that changes.
Yeah, I think I'll answer it for you. Yeah. I think they're buying you, Dr. Seth, and patients are buying me.
Yeah.
And I know that may sound arrogant to some, but I think I know the quality of doctor that I am. At least I'm not the best doctor, but every day I certainly try to be the best doctor I can be. And I know you do the same.
Yeah.
And patients will recognize that at the end of the day. So they are buying you.
I think a bit of that is where I won't accept that for myself. It's probably from, mm-hmm. That insecurities that we've always had, that I still have to continue to prove myself. And I don't think that'll ever change. And I hope my patients benefit from that.
Yeah.
I think when we were talking about what services we're going to provide, concierge was one of them. We talked about what's called patient advocacy. In my years of ethics, mm-hmm. I had spent so much time working on figuring out such extreme complexities, situations for one individual patient. And we would find really great, ideally great solutions for these patients. And I was like, maybe I can provide this more to more people.
Mm-hmm.
But then one day, Nir and I were talking, and we just kind of needed to know our focus. And it came to me that we're reminded of my mother.
Mm-hmm.
So
you want to share a little bit of that story?
Yeah. So my mom, she passed away of breast cancer in 2014. She was diagnosed with breast cancer when I was doing my internal medicine rotation in Cleveland Clinic. So that's part of the reason why, like, I got a little bit of a focus on it. She called me, telling me she had a lump in her breast. She found it in the mirror, and her voice was quivering, and so I remember, like, okay, I had to be strong, and we talked about the next steps and what we're gonna do, and my mother, she was one who did not like to go to the doctor. She did not like any medicine. So, she didn't believe in a lot. It's not that she didn't believe in preventive care. She rather.
And it may be a generational thing.
Yeah, I think that's,
or a
I think that's a
cultural
big thing. Yeah. I think she just liked to ignore things,
thing.
Anyways, so things went well. And Neer and I got married. And, a little bit later, we were trying to figure out residencies. And so we thought, we'll figure out we should be closer to home. And, my mom had cancer at the time, even though she was in remission. It would be good to be closer to home. We thought we'd start a family, etc. Well, my first year in residency, I got a call. It was May, and I was in my truck, and I was sitting in a parking lot, and my mom called me, and she said, she was crying, and my mom never used to really cry in it. At least I never heard her cry on the phone, and she was telling me that the first sentence she said was, "They say I'm gonna die," and wow. I was like, "What? Like, what are you talking about? What are you talking about?" And as soon as she said that, all of the information that she'd been talking to me over the past months flushed forward. She'd been talking about backaches, and she'd been talking about night sweats, and it's like I hadn't even thought of it. And she said, I said, so tell me what happened, and I'm sitting there, I know I can't panic. And I'm like, tell me what happens. She said, I've got cancer in my spine. It's from my breast. And they're going to start chemo. And I said, okay. And then she paused. I said, are you with somebody? She said, no, I'm by myself. I said, didn't they tell you to bring somebody? And I'm now getting a little guarded. And
sure.
No. And then I said, and then she paused and she said, she left the room. And then as soon as she was leaving the room, I asked, how long do I have to live? And she said, 1 to 3 years. And then she left the room. And that's all my mom remembers. Wow. And my mother that day stopped trusting that doctor. Now, that doctor, we went back and talked to her, and she made a big effort to try to resolve things, but that trust was lost.
Right.
And then it also affected our family, because seeing her go through this, and then on top of it, not thinking that she had the right, connection was really affecting me. So Neer and I talked about, what are we going to do for our patients here? And I said, I'm going to be the doctor that I wish my mom had.
Yeah. It's beautiful.
I want to make sure that they're not alone, that they're not lost, that I'm not running out the door with a hand on the doorknob, walking out to the next room.
Yeah.
And if that means that I'm not making successful jumps in a corporation, so be it.
It's beautiful.
Medicine has benefited me. It's time for me to give back in medicine.
Yeah. That's absolutely beautiful. Can I be your patient? Wow. It's beautiful. Did you have a hard time balancing between being a son and a physician in those moments?
I struggled so much.
Yeah.
I had a really difficult time.
Yeah.
It was difficult on me. It was difficult on my marriage. It was difficult. And I was a first year resident. You know how that is that year. It was, I can't even think of like all the details, but all I remember is the cloud lifted after she passed away.
Yeah.
And my focus was my kid, and
Yeah.
I never looked back.
Doctor says what I tell patients and what I remind myself and what I'm going to remind you, as difficult as that situation was, we should never question the path, right? I think there are situations in our lives that are out of our control. And I know for me, growing up where I did, the experience I had as a child growing up gay, hiding that, taking both of us the path less traveled, having death in the family, situations, I think they have all molded us into who we are sitting here today, right? And I look at that and say, maybe it is a gift at the end of the day, where all the tears, heartache, sadness, whatever has led to me being the doctor I am today and you being the doctor you are. And I think that is a beautiful thing. And I think that all can get molded into a perfect piece of this puzzle of being what we do every day in our lives now as a concierge physician. And it is the relationships, right? So I would not question the path.
The path less traveled.
Correct. Yes. Is there any fears that you have now that you have made this transition? And walk me through what those are. And when I say transition, so starting a new career, starting this new concierge practice.
So whenever you start a new business, there's personal and financial risk. The personal risk is limited because I'm working with my wife. I see her every day. She is everything. Like, she's the backbone to our business. She keeps me in the straight and narrow, right? So if ever there was a moment I questioned is one's contributions in the marriage, she is making up for all of my lack of contribution. Yeah. So she's been amazing. So from a personal standpoint, it's been really great. The financial part, I'm going to be honest with you, is really stressful. We bought a building. There's a mortgage on there. Florida has expensive insurance.
And where are you located?
We're in Tampa, Florida.
Okay.
So
right. Greater Tampa.
Yeah, it's in an area called Carrollwood. It's a little bit north central of Tampa.
Okay.
It's like below the suburbs area, but it's very centrally located.
Got it.
We're in a great location, a very prominent area of it. So I think and also it's I'm not gonna say the underserved, but it is concierge medicine is not as common in this area.
Okay.
So we're based on the market analysis, we kind of made a decision of being in this area. So there's a mortgage. There's a lot of costs associated with running a clinic.
Mm-hmm.
There's supplies that you buy. There's medications that run out or that expire.
Mm-hmm.
Nir and I do not take a wage. Our goal is to grow the business, grow our practice so that we can provide for our patients. So if I don't take a salary, I got to do something else. So I still work as a hospitalist. I'm going to be working at Bay Care here, which is a hospital system in Tampa.
Mm-hmm.
And I do a lot of teaching with the residents there. So there's ways that I can do things to make ends meet, but it's challenging. It's challenging, yeah. And I think that's, again, like I don't think I would have been the same guy if I didn't go through that path.
Sure. I think it also solidifies the fact that you're also human too. And yes, we are doctors, but I also don't want to dismiss the fact that we're humans too. We have the same struggles, the same financial dilemmas, the same concerns like everybody else. I do think medicine is absolutely a calling. And I think we we have been put into certain situations that make us who we are today. And I think it is a calling, especially for what we are currently doing.
Right.
But it's an honor to share this journey with you, my friend. So.
Pleasure's been mine. The pleasure's been mine. So when you open your practice, how did you transition? Because you were at Lifetime, right?
Yeah.
And then you open your own practice, but did you have a second job? What did you do?
Yeah. So at Lifetime, we were a DPC practice, which means direct primary care. And I knew from that experience, I did not want to be a DPC practice. And we can get into that in a separate episode. I wanted to do 100% concierge, and there is a difference between the two, as you know. So I, like you, the fear was the finances. And probably for the first year, I ate a lot of Lucky Charms and a lot of Fruity Pebbles. I knew that I needed to, obviously I had a family that I needed to take care of. I still had bills and loans, but I had an amazing opportunity to work with one of the hospital systems and work as an urgent care physician. And I worked as a locums. And I know when you are under a locums contract, you do get paid a little bit extra as opposed to being an employee. And for 1 year, 7 days a week, I was a doctor. I worked 4 days a week as an urgent care doctor and 3 days a week at Parker Medical for 1 year. And I had, at the time, put together a great business proposal for a bank to give me some money to help start the practice. And every bank denied me. I had perfect credits. Yeah. But they did not understand the concept of what concierge medicine is. And my only hope was my poor parents' retirement. So I begged them for $100,000, which they graciously gave me. And of course, that fear looming over you, if I fail, how am I ever going to pay them back? This is their retirement. But I just believed in myself, and I knew I believed that there was going to be a better opportunity for my patients. Right. And that's what drove me every day. But I worked and was able to manage a lot of that, but it was a lot of work. And slowly but surely, we built the practice from 1 patient to 5 patients to 10 patients. But that first year, I was the physician, I was the nurse, I was the administrative assistant, I was answering phones. And again, that process made me a better doctor too, because I have a newfound appreciation for all the different roles that these individuals have in the clinic. Yeah. But after 1 year, I had enough money to pay my mom and dad back with interest. I had hired 4 new people, and it was off to the races.
Amazing.
So
how many staff do you have in your
I have 12 right now.
Incredible.
Yes.
So you have, so how many physicians?
So we have 3 physicians, including myself. We have a nurse right now. We have my sister, who works as our patient coordinator and our brand ambassador. So when patients call and are interested in the practice, she's the one that talks to patients about what concierge medicine is and what we provide at Parker Medical. And then I have several medical assistants, administrative assistant, and my husband, Jason, does all of the operations side, which, like you with Nira. Yeah. So I could not do my job without him.
So understand one thing. Jason is an incredible human being.
Just ask him.
Yeah. So, and this is for those who are watching. Jason, and with Ryan's help, they provided not only a template, they guided us and we consulted with them, and they guided us so incredibly that we have basically been able to mimic their clinic across the other side of the country. And it's just been, I can't tell you how important that was for us, because like I said, that at the time that we were trying to build our clinic, I was trying to find my identity in the clinic. Never mind like the identity of like my electronic medical record,
Yeah.
my billing company, and these are very, very complex decisions. And I was able to,
It's very overwhelming.
and then when you guys came through and helped us out, I mean, we owe you the world.
Oh,
I mean, I can't tell.
I want other doctors to experience what we are currently experiencing.
Yeah.
I think the doctor that I work so hard and trained to become is the doctor that I get to be every single day.
So can you tell me a little bit about the consulting service you guys provided for us?
Yeah.
Can you tell me a little bit about that? Like,
sure.
How did you develop it? Because it came from all your experience, right?
Yeah. So we started a small consulting company called Structured MD, and it is designed to really help those physicians who are extremely burned out or looking for other options. They want to practice medicine, but they may not know what other opportunities are out there. And they may have heard of what DPC practices do, or they may have heard what concierge medicine practices do, but they have no idea how to make that transition. So we do have a consulting company that helps those doctors become concierge doctors, and really training those doctors to be not better physicians, but better advocates for those patients that I think will get better care in a concierge setting.
You know, I was looking at one of the concierge providers in town,
mm-hmm.
and I kind of just asked, you know, how does their practice run? And they do kind of a DPC model.
Mm-hmm.
You know, they don't bill insurance, and I guess the crux of the matter is they have 4 walls and they have themselves, and that's it.
Yeah.
And part of the complexity of medicine in today's healthcare is there are ways to do that. You can have a clinic with 4 walls, you take cash from a DPC, and that's it.
Mm-hmm.
But if you're going to level up, if you're going to provide an incredible experience,
right,
you also got to bring different levels to the game.
Right.
And I think that's what Structure MD did for us, is that it wasn't this like the seamless process for payment.
Right.
You know, our patients don't have to worry about writing us a check. I know this sounds silly, but that is actually a big deal.
Well, I think it's an art to understanding the business.
Yeah.
And I think you just needed the template. You have the skills.
Yeah.
You just needed the template to get there. So what Structured MD is designed to do is really give you a bird's eye view of what concierge medicine is.
Right.
And to meet you wherever you're at in the journey. You may already have the practice, or you may not, but we are really there to help guide you, because I really want to empower other physicians who are really feeling the effects of today's modern medicine to know that there are some better options out there for your patients.
Yeah. My wife and I talked about like potentially getting an MBA prior to us building a clinic. I saved myself hundreds of thousands of dollars by going through you guys instead of, you know, going through an MBA. And then honestly, like,
can I give you the honest truth why I got the MBA?
Please tell me.
So when I had decided to start a business and I was so broke and I had all this money going out and I also had student loans to pay for, the only way I could stop payment on those student loans was to go back to school.
No. So you put yourself into more school and you had to pay for that too.
I had to pay for that, correct. But it allowed me to defer my loans.
Oh my God.
So I had to do that, but we did it. We made it. And now,
that's
the rest is history.
That's a hell of a journey.
It is.
And and you were still going 7 days a week.
Correct.
4 days in the urgent care, 3 days,
at
and
Parker
then doing
Medical.
your MBA.
Yeah. It was all worth it. You don't question the path, right?
That is not the path frequently traveled.
But I want to wrap this up, Dr. Seth, before we get into some other episodes on really what is DPC, what is concierge medicine, and really what that means. But is there anything else that you would like people to know about you? Rishi Seth, the person, or Dr. Seth, the doctor?
I think the thing, this is something that I'm learning over the past year. The physician I was and am to this day, that hasn't changed. The family man that I was 5 years ago, 1 year ago, today, that hasn't changed. I think what I want people to know is that my focus on medicine, my focus on providing the best care possible has to be that I'm going to treat them like my family.
Mm-hmm.
And I think if they see me with my family, then they understand that they're part of my family.
Right. Right.
And I think that's it. If my patients can feel like they're at home, then I've done my job.
Yeah.
Because that relationship is there, that connection is there. And I truly feel that this is how medicine is going to be in the near future, in the generation of AI.
I agree.
I actually think that this is how we stay valid by creating that connection.
I agree. I love being a doctor.
Mm.
I absolutely love being a physician. And I ask several colleagues if they like being doctors, and they don't. Very rare do you find someone that says, I love what I do, but I love what I do. And it is really the chance for me to really have that relationship with patients, to not feel the strain of a system that is crumbling, but really help those individuals that I think are really desperately looking for help. So thank you for your time today.